Christine Goodall. Christine is a senior clinical lecturer in oral surgery and lead clinician in oral surgery, and also a member of Scottish Health Action on Alcohol Problems, or SHAAP. So Christine, you just want to say a bit about what your job role is, or what both job roles are?
Sure. So my day job anyway is I work as a consultant oral surgeon in the Glasgow Dental Hospital in the centre of Glasgow. And as an oral surgeon, we obviously deal with patients coming in who have a variety of issues related to alcohol, and one of those is oral cancer, which is obviously fairly strongly related to heavy drinking and also smoking together. But we also see a fair amount of trauma related to alcohol, and I have worked for 12 years in oral and maxillofacial surgery around Scotland, and obviously saw an awful lot of patients at that stage with facial trauma related to alcohol, so more serious injuries. And so that's the kind of thing that I do for my day job. And I'm on the SHAAP executive board, where obviously we try and look at different ways of tackling the alcohol problem in Scotland from a health perspective, because we all work in health.
Okay, so could you maybe just sort of tell us about, so obviously throughout the last few months we've been in lockdown first of all, but overall there's been the pandemic, and there's been some research done on separate effects both in lockdown and in the pandemic overall on mental health. But there's been a lot of stuff coming out about alcohol and alcohol use, issues around it, such as unintentional harm, antisocial behaviour, things like that. Could you just maybe tell us a bit about what SHAAP are seeing, or some of the main themes that have come out of lockdown and the pandemic regarding alcohol?
So I think there's a few things. I think, some people have probably been drinking a lot less during lockdown, which is a positive thing. So we'll start with a positive. Other people obviously will have been drinking more, and they may be people who are not normally heavy drinkers, but because they've not been interacting with people in the normal way that they would, they've not been getting out perhaps to work. Some people obviously haven't been really leaving the house very much at all. That's essentially, I suppose, what they're doing to socialise, that in of itself can be a problem. We also have, obviously groups of people who are addicted to alcohol, and for whom this has probably been an extremely difficult time because they've not had perhaps as easy access to their normal supports. So one of the other things that I do is I help run the Navigator programme in Scotland, and navigators are support workers who work in the emergency departments normally, and they support people with a variety of different issues, one of which is alcohol. And I know from the group of navigators, the 14 of them that we have, they have been very much supporting people to online meetings, Alcoholics Anonymous, Narcotics Anonymous, etc. And they've found that has really helped some people. So I think so there have been a few things, I think. So obviously, as I said, people have been either not drinking as much, or they've been drinking more, which is potentially harmful, or they're in that position where they are addicted to alcohol, and they do have a really significant problem, and perhaps some of their normal supports have not been available to them. But there have been ways around that people have been finding to try and get people support. So I think a few different things have been going on there just with drinking. But then you've also got added issues, I suppose, for some people. So very difficult, particularly for people who perhaps are in a domestically abusive situation during lockdown, and there have been a lot of reports of domestic abuse increasing during lockdown, because people have been locked up with their abuser. Now, we need to be very careful not to insinuate that alcohol causes domestic abuse, but if people are also drinking at the same time, that might actually exacerbate things in terms of the violence. So we need to think about that as well, and that's another issue.
Yeah. I'd done an interview last year with Martha Scott, who's Marcia Scott, sorry, from
Marcia Scott, yeah.
Scottish Women's Aid, and yeah, she was keen to point out that what we tend to see is that domestic abuse or and emotional abuse, etc., tends to go on anyway. But where we see spikes is when it tends to be that alcohol has been involved and the person loses control of how hard they're hitting somebody.
Yeah.
And therefore we tend to see worse injuries, which then tend to be reported more often rather than just the sort of more.
Yes, absolutely. And you know, I mean, it's almost inevitable that if people are drinking, they become less you know, less inhibited than they perhaps normally would be. So violence is much more likely to escalate at that time. But yeah, but we just need to be clear that violence doesn't, alcohol doesn't cause domestic abuse, but it is an exacerbating factor.
Yeah. Just as so you mentioned a few issues there, particularly around the sort of increase in drinking, and that's something that's been quite widely reported, particularly perhaps in people who already have existing alcohol use disorders that have been finding it more difficult to cope and perhaps drinking more. But in general terms, there's been maybe a bit of an increase with some people, and then a decrease, on the other hand, with others who've maybe either cut down quite a bit or else stopped altogether. There's a couple of other things that I guess have come up for us have been sort of antisocial behaviour around drinking, particularly outdoor drinking.
Yeah. I mean, we've certainly seen that in Glasgow. I'm not sure if you're in Glasgow as well, but we've certainly seen that in Glasgow when lockdown has eased slightly and people have been able to go out of the house a little bit more. There's certainly been a lot of congregating in parks, quite heavy drinking, antisocial behaviour ensuing as a result of that. And that's been seen in several parks around Glasgow, I think, and you know, particularly with younger people indulging in that behaviour. So, and that's quite difficult because then, you know, that's potentially a lot of people who could be spreading COVID, getting together, becoming much less inhibited than they normally would be because of the alcohol that they've taken on board, potentially sustaining injuries, having to go to hospital, an additional strain then on the NHS from all of that frankly didn't need to happen. You know, and quite a difficult issue for the police to deal with, because again, they're then putting themselves at risk as well, because they're having to break up large crowds of people who are probably not being terribly compliant with what they're being asked to do. Yeah. So yes, so that has been a problem, and you know, while I guess in a normal good summer in Scotland you would see some congregating in parks and some drinking outdoors, etc., probably not to the extent that it has been going on. And I think that's just you know, it's obviously been a function of people being kept away from each other, and you know, the want to get together and to have fun and things, but it just gets out of hand sometimes, you know. And I think there has been, certainly in, you know, the big parks in Glasgow, there have been people coming from quite a distance to congregate in the parks.
Yeah. And interestingly, actually, we spoke with Shirley McLaren, who's a community safety manager in Edinburgh, early in the pandemic, and even in Edinburgh, where obviously outdoor drinking is allowed up to a point, they were reporting problems with antisocial behaviour, particularly in parks as well, but perhaps not wanting to lose the kind of more light touch regulation around that they have in Edinburgh. So that was quite interesting to see too. Yeah, you mentioned as well there's been a bit less support available, and certainly I know that AA meetings, for example, are now sort of only on Zoom a lot of the time, and we've certainly, at my other job at the Glasgow Council on Alcohol, we've seen a reduction in referrals into our service. So I don't know what's going on there quite, whether it's people are less interested in getting sort of online help versus face-to-face help, or what's driving that. Do you, maybe say a bit about sort of loneliness and isolation, because that's been a big factor in lockdown, and do you think that that's behind some of the sort of issues we're seeing with alcohol?
Yeah, I think loneliness has a massive part to play, and again, that's something that we've seen through the Navigator programme. When people are turning up at hospital for whatever reason, one of the underlying issues there at the moment certainly is loneliness and being isolated from people. And I think it's it's without doubt that actually people do get a lot of support just from being with other people. And I think if you live alone, if you have an issue with alcohol, and you don't have any support around about you, any other distractions, I think that's only likely to get worse. So I think there have been an awful lot of people for whom it's been very difficult for them to get a handle on their drinking, where perhaps they had been going along to supports beforehand, they'd maybe been going to meetings, they'd been getting that support from the other people in the meeting. It's just been a wee bit more difficult for them during this time. But I have to say, I've heard quite positive things about the online meetings. So some people, for example, going along to those who wouldn't have gone to a face-to-face meeting just because it's a wee bit more anonymous, and you're perhaps meeting up with people from further afield who perhaps are not likely to know you or know anything about you, and they're finding that a bit more acceptable. So I've heard some quite positive things about the online meetings, and I think maybe going forward, these organisations will take a blended approach to that, so that they will offer face-to-face for those that want them and online for those that would rather not do that. So, but yeah, I think lockdown has had a massive impact on mental health generally for people, and I think the not being able to get out, the being stuck within the same four walls, if you don't have any outside space to go into, if you've not been able to go into a garden or anything, I think that's been really hard for people. And I don't think it's altogether surprising that perhaps alcohol has been what people have been turning to get them through it.
Was going to sort of ask a question on whether you think there's any particular issues relating to alcohol we need to be thinking about as we begin to emerge from lockdown, but it might well play into the next question, because one of the most obvious ones is the spread of COVID-19 and keeping safe from transmission of COVID-19. So there's been a lot of obviously media reports recently about it seems to be bars are the kind of hotspot for transmission at the moment.
Yeah.
Obviously the lockdown in Aberdeen again seems to have centred around bars being opened. And there was one English police chief that had said earlier in England's lockdown, which obviously happened a bit earlier emerging from it, that it was crystal clear that drunk people can't socially distance. So in terms of sort of managing that, what do you think that we can do to, or that bars can do, that individuals can do, or even partnerships can do to try and sort of work together to keep people safe from COVID?
Yeah, it's difficult, isn't it? Because there is an economic issue there for all these businesses, and we have to remember that they are, the pubs and restaurants as well are businesses. So, but I think there is undoubtedly an issue with people not being able to socially distance when they've been drinking. I think, again, the inhibitions disappear. People actually do want to be close to each other. That's just a natural human thing. And I think it's much more difficult to prevent that from happening when you've been drinking. You also can't really wear a mask and have a drink, so that's that's difficult as well. And I think I was actually reading something just before I came on to speak to you about how COVID can transmit itself around a bar, with the amount of breathing that people do, that having to shout louder to hear over other people because there's obviously a lot of bustle, and if there's background music, and actually if you had one of the bar staff, for example, who was COVID positive and maybe didn't know, the potential for that to spread around a bar is massive. So I think the alcohol industry probably needs to think about having everybody seated, making sure that their drinks are brought to them rather than them having to go to the bar to get them, obviously limiting the number of people that can come into a bar at any one time. And I suppose potentially you could really be thinking about, if you think people have had enough to drink, then you shouldn't be serving them anymore. And I think bars are meant to do that anyway. But it's maybe a time when that really has to be a bit more strictly enforced. Not letting people who are clearly drunk into the bar in the first place. But I think I've been in a couple of restaurants since lockdown eased a little bit, and I have to say they were doing pretty well in terms of keeping people apart and having barriers between tables and so on. So I think some of the bars maybe need to take a lesson from that. And we also what went on in Aberdeen and the queue outside the venue that people were going to, and people were just cheek to jowl. They were very close together. So I think we know that COVID is transmitted by aerosol, and we know that if people are shouting and screaming at each other because they can't hear or because they've had too much to drink, it's much more likely that you're going to transmit it. And the fact is that people seem to be infectious quite a bit before they start to show symptoms. So I think it's a really difficult one, and I think the inevitability is that we will be getting local lockdowns, and it will be the hospitality industry that suffers the most from that, because they'll be the things that you can't shut all the supermarkets particularly, but it will be the hospitality industry that will suffer from that. But I think that's almost an inevitability, and I don't really see any other way around that.
Yeah, I've seen certainly or heard some examples of good practice in some bars, and one of the things was that they're playing music more quietly, so that they don't have to shout as much. And sort of other things, like I've definitely seen table service rather than going up to the things. So it's good to see.
No, absolutely. And all these things just make sense, because you want to limit your contact with other people. So if everybody's going up to the bar, it not only puts the bar staff at risk as well, frankly, but it increases the chance that you'll pass by somebody who's COVID positive, and and then you'll catch it and you'll pass it on to somebody else, etc. And I appreciate a lot of the people associated with the incident in Aberdeen were young, and they'll probably recover and they'll probably be fine. But the fact is, they're going home to other people, to older people, older relatives, and that's where it all starts to get really difficult, doesn't it? Because those people are much more at risk of having a serious infection and ending up in hospital.
I think as well, you obviously mentioned that there are some bars where people have been kind of maybe queuing cheek to jowl and things. And I was passing through Glasgow yesterday through the Merchant City, where there's now a festival space or a beer space. And they were doing the social distancing and the hand sanitizing within the venue, but the queue outside, people were very close together. And so so probably a role then for as you say, the drinks industry to work with health, community safety, and other people to sort of make sure that we're taking all the necessary measures, not just within the bar itself, but
outside. And it might be that if you want to go for a drink in a bar, you need to book a table. Because that would stop people from queuing outside. I guess it's very difficult for the bar owners to police what is essentially outside of their business. But I think at the moment it just has to happen somehow,
It did crop up in my mind as well while you were talking about the fact that they're being served at tables, and that maybe bars could look at not serving people if they've obviously had too much to drink. This could be a good opportunity for the bars to keep a tally of the number of units they've served to individuals.
Maybe you should have a wee thing on your table that says you've had 3 units, so you're only getting one more.
You get 4 units, and that's your safer in one session done.
That would be one way of keeping people within the recommended drinking guidelines, wouldn't it?
So kind of leaning into another question, because it does again relate to COVID-19. So you kind of mentioned obviously about we were talking about the transmission in bars, which is important as well, obviously, because there's been research, I think, showing that alcohol increases your risk of suffering from complications or even transmitting COVID-19 because it weakens the immune system. Do you see a bit more about that?
I think if that was the situation, you'd probably have to be you wouldn't need to be somebody that was maybe drinking 1 or 2 drinks a week. It would probably need to be somebody who was chronically drinking a lot of alcohol. So I think for the vast majority of people perhaps who are in bars just now, that probably won't be such a big deal. But when you're thinking about the people who are sitting at home drinking a lot and are chronically drinking a lot, that'll be more of an issue for those people, I would have thought. So important that they get access to support, that they get, if they need access to online meetings, that they can get access to it. And that's been an issue we've come across actually, is that some people are unfortunately in the situation where they don't have the technology to get onto these online meetings. So that's something that through the Navigator programme, we've been supplying people with smartphones so that they can access online meetings and they're not completely missing out the chance to get support.
I suppose even not just the lack of the technology, but not able to use the technology, because there's some people that I attend an AA group, and some of the older members aren't as technologically competent to get onto meetings sometimes.
No, that's right, yeah. We have the same issue with obviously a lot of our consultations are being done virtually just now, and we have the same issue with that some people just, they might have the technology, but they're not very good at using it, so, which is understandable, But yeah, I think the health problems for people with COVID would really be if you were a chronic heavy drinker rather than an occasional drinker.
I suppose there's that thing of what people's definition of that is, and
yeah, that's true.
People maybe don't realise that sort of going over the safer guidance is going to start then increasing your risk for health problems, and even what you may not think is a huge amount of alcohol actually is potentially damaging to your health. Quite
significant, yeah. And I mean, you'll know yourself that there are an awful lot of people out there who don't recognise that they do drink more than the safe drinking guidance, which is only 14 units a week. So a lot of people would not realise that they had gone over that.
But as I used to, I often kind of say I could do that on a Tuesday night in the pub, never mind a Saturday or a Friday.
Well, I think a lot of people would manage it on a Saturday night, no bother. So
one other kind of thing, just on that topic, because Michael Marmot had kind of has written a piece today in The Guardian, and there's been a lot of stuff about the COVID pandemic exacerbating existing health inequalities, which also exist around alcohol, obviously. Just any other additional thoughts on kind of maybe how?
I mean, I think that's inevitably what has happened, and that's not to say that people who are more affluent are immune to this. Of course, they're not. And people with underlying health conditions, perhaps that are not related to inequality, are obviously not immune either. So there's an awful lot of people out there, obviously, who've been shielding, who have a variety of different health conditions. But I think when you look at sort of health inequalities, and the more deprived sections of society, they're living in more high density housing, so much more difficult for them to socially distance even within the buildings that they're in. Their diet tends to be poorer just because obviously they don't have as much money, and so it's more difficult to buy a healthy diet. There tend to be more smokers amongst that population. Smoking obviously not a great thing for a respiratory infection. It is the case that alcohol problems are more common in the sort of more deprived end of society. So when you add all these things up together, and then maybe add into that, if they are working, perhaps they're working in an area where there are a lot of people working. So if you're working in a factory, for example, obviously again very difficult to socially distance in those places. And our food production industry has continued, so there are still people working in high density work environments where perhaps the attention to protective clothing, etc., at the start of this was maybe not as good as it could have been. So I think COVID has just exaggerated health inequality. And I think when we look back on this, that will become obvious. When people start crunching the numbers, it will become obvious that COVID has exaggerated these inequalities. But I suppose in a way there's an opportunity to try and change that, because it will become really obvious, I think, when they do all the number crunching. So maybe that gives us a wee bit more ammunition to try and change things. But it's really, you'll know yourself, it's very difficult to get groups of people to change their drinking behaviour. Easier, I suppose, with individuals, because if people decide that they want to change their drinking behaviour, and that's something that they're very focused on doing and proactive about doing, they will manage to do it. But more difficult for big groups of people.
Yeah. Obviously, we were talking about pubs and transmission and whatever, and I was reading an article in the conversation about how some people are still a bit reluctant to go to pubs because of the safety concerns. Although I suppose in a way there's a risk as well for with driving people or encouraging people to stay home and drink, because obviously historically that's where the cheaper alcohol is available, and
that's right.
We are drinking, and then there are risks attached to that as well, where obviously in terms of unintentional harm, most unintentional harm occurs in the home.
Yeah.
Fires, the Scottish Fire and Rescue Service.
Yeah, the fires and everything, yeah.
I've just been doing a campaign on sort of, I think it's over 50s and drinking and smoking, but because obviously the risk of house fires. So there's risks on both sides, isn't there really? So
there are, and you probably would have thought that before COVID, going to the pub would have been, perhaps, if you wanted to sort of curb drinking a little bit, going to the pub might have been the safer thing to do, because you probably would run out of money before you would, get yourself into sort of significant issues. And somebody probably would, if you were really completely, miraculous, somebody would probably have suggested that you left the premises. Whereas that doesn't happen at home. People can just carry on drinking, and they'll often drink more with not having pub measures, and not having anybody to maybe tell them that enough was enough. They'll just carry on, and then you run into all these other harms around the house going on fire, having accidents in the home as well. So that's not obviously uncommon.
Well, I think the notable ones early in the pandemic was a substantial increase in trampoline injuries, which obviously trampoline wouldn't be. Yeah,
you go into the back garden and have a play about in the trampoline. But then the other problem with drinking in the house, obviously, is if you're doing it with other people, and just I think we all appreciate that despite the fact that households were told to stay apart, that did not always happen. If you're drinking with other people, there is the potential to get into an argument, and that can turn into a fight. And violence in the home is much more common now. And I don't mean domestic abuse specifically, but violence in the home is much more common because things just get out of hand sometimes.
Yeah.
And it's not, you can't police that,
Yeah. And obviously there's then the attendant having social behaviour, noise complaints, etc. Well, just one final short question. Just keeping an eye on time here. I'll keep this very brief, because I know you said you didn't maybe know too much about it. But so in the SHAAP media monitor recently, and some people might have been aware of it from other sources, Break, the road safety charity, has again kind of voiced concerns about a lack of action or real change in deaths on UK roads, and is calling for more action on dangerous drink and drug driving. Obviously Scotland reduced our drink driving limit to 50 milligrams per 100 millilitres of blood, which is lower already than England, which is still at 80. Are further interventions on at least the drink drive limit something that SHAAP is supporting or campaigning for? Or
it's something that we would be supportive of. I think at the moment there isn't a big campaign surrounding it, but obviously the more harm you can prevent from alcohol, the better, and we would always be supportive of measures that can reduce alcohol-related harm. And I did see something about drug driving as well, which is obviously becoming possibly even more of a problem than drink driving, because at least with drink driving, the limit has been reduced quite considerably. So people really can't have an awful lot to drink and hope to be able to get away with it. But drug driving, you know, I mean, I appreciate people are stopped and they are drug tested, but you know, there isn't it's not quite the same in terms of a limit on that. And I'm sure people probably do think they can get away with that. So I think we'd be supportive of anything that can reduce harm related to alcohol. And, you know, if there are other ways of doing that through legislation around drink driving, then I'm sure that's something we would be in favour of. You know, I mean, our drink driving limit is quite low now, but, you know, it may be in the future that has to come down further.
Because there are some European countries that are even lower.
Mm-hmm.
What, is it 40 that's the kind of, or is it 20 milligrams?
I think I had thought between 20 and 40, but I can't think which countries it is. But there are other countries with lower limits, you know, and there's I've certainly, when I've been in, my sister lives in Australia, and when I've been there, I mean, they have an absolute, you can't drink anything.
Yeah.
You know, so if they're out catching people and you've had anything to drink, you're in big trouble.
And I do find that myself with when we do alcohol awareness sessions at Glasgow Council on Alcohol, it does cause a bit of confusion with people. So they want to know, when you talk about the drink drive limit, they then want to know, so how much can I have then before I... Mm-hmm. So even the fact that they ask the question, we have to then sort of say to them, you're just best off not. But if the limit was so low that the guidance was basically do not drink anything and drive, it would just make it much easier.
I mean, I don't think that would be a bad thing personally. I think that would be completely acceptable to say you can't drink anything, because, you know, it's so kind of borderline what you could drink and still manage to not be over the limit. I think you're safer just not having anything. Yeah, you know,
it depends so much on the individual as well and how they metabolize and process alcohol through their system.
Yeah, absolutely. So I think the safest thing is nothing.
Yeah. Okay. Well, just so that we don't run out of time and get caught off something important, we'll leave it there. So thank you very much, Christine. That was really...
No, not at all.